My name is Meena, and I'm one of the pharmacists at Priceline Pharmacy in Maryland. Lucky to be working among a helpful team. During winter season, it's mainly not the cold weather that's actually to be blamed. It's mainly because people tend to go more indoors, and that can actually create more chance of infection. But mainly common cold, like we said, upper respiratory tract infections. You get sore throats a lot, cold sores, especially if you're stressed. Some people get dry skin problems and even painful joints as well. Always, if you're gonna sneeze or cough, always cover your face, and always throw away the tissue that you used. Wash your hand quite often, especially after sneezing or coughing. Or you can use like a alcohol-based hand rub as well. If you think you're sick and you're not well, just maybe stay home for a bit, get some rest, and then maybe keep the kids, if they're sick, away from school and other activities. Yeah, there's so many supplements in the market regarding the flu. So zinc would be the most common one because it's been shown to boost your immune response and may help you reduce the duration and intensity of the cold, especially if you take it within the first 24 hours of the onset of the symptoms. Some people prefer to take zinc as a preventative prophylaxis measure, and they usually do that like 5 weeks in advance of the flu season and the cold season, and it may be effective as well. You can find vitamin C very effective along with echinacea. Especially echinacea can increase your immune response, and by fighting the cold, and actually can increase the white blood cells in your body. Other beneficial supplements would be horseradish, garlic, olive leaf, so many supplements. Plus, if you tend to suffer from like dry skin during the winter season, I would recommend that you use a lot of moisturizers, drink lots of water, use supplements that's got vitamin E especially, and omega-3 fatty acids, which mainly exist in fish oil. Some people get like painful joints, and that's mainly can be fixed by glucosamine supplements and chondroitin that may reduce the pain and inflammation, and also can improve the mobility and function of the joints. That's a very good question. Mainly the flu is not your common cold. It's not the normal common cold. It's much more severe, and basically you can differentiate it by the flu always causes high fever, while the normal cold would cause only mild fever. The duration of the illness itself, the flu would last more than a week, while the common cold lasts for a few days or just maybe a couple of days and then goes away. Another thing is, with the flu you always get muscular pains and shiverings, like your muscles will be aching, while the cold doesn't cause that. Another thing as well you can notice on the kids, basically they get runny nose only with cold, while the flu usually starts with a dry sensation. You find them dry in the nose and the mouth, and if kids got the flu, the last thing normally they get like vomiting, nausea and diarrhea. You find that with kids more than adults, especially with the flu, not the cold. Of course, there is no specific treatment for the cold. There's no cure that can make the cold go away more quickly, but the symptoms may be relieved by certain measures. Mainly paracetamol, like Panadol or any brand that got paracetamol in it, especially if you have high fever. Nasal drops or sprays that got decongestant that can actually help a blocked nose. Also drinking lots of warm fluids that can actually help with dry mouth and sore throat. Lozenges, especially like any brand is fine, but always for kids who are like up to 6 years and not younger than 6. You're more than welcome to come to our pharmacy, Priceline Pharmacy in Maryland. We are more than happy to help you out with any inquiries you would have.